Welcome to Tapping In, where we tap into the wisdom and experience of successful leaders. I'm your host, Gwen Brain, and joining us today is James Bates from AdviNow Medical. Thank you so much, James, for joining us today, and I can't wait to hear what all you have to share. So first of all, tell us a little bit about your business.
Hi, Gwen. Thanks for having me. My name is James Bates, and I'm the founder of AdviNow Medical. AdviNow Medical uses artificial intelligence to completely automate the medical visit. The crazy thing about the medical industry is that 66% of the time a physician spends in their day is spent doing clerical work that, quite frankly, anybody could do. AdviNow uses artificial intelligence to eliminate that overhead burden on physicians so they can actually enjoy their life more, see more patients, spend more time with patients, or make more money, right? I'll leave it up to them to decide what they're going to do.
Yeah, that's wonderful. So I have several friends who are physicians. Do you do this in hospitals or do you do it in primary care offices, or where does this show up?
AdviNow Medical can be used anywhere where a medical encounter takes place, where a patient actually has a conversation with a doctor. And so this is in hospitals, of course. Hospitals are the classic place we would think, but it's in clinics. It could be in your convenience store. It could be with your pharmacist. Really anywhere where a doctor, some type of provider is collecting information, making a determination for the patient, and then prescribing some type of treatment plan. And, you know, the crazy thing is this could even be your fitness instructor, even follows all of that same workflow. So AdviNow could be used anywhere where that workflow is used.
That's super cool. So what made you get into this? Like, what was part of the journey that drew you into this particular AI area?
So in my previous life, I had the opportunity to be involved with self-driving vehicles. I ran a billion-dollar business that actually made the technologies that Tesla, Google, Daimler, GM, everybody uses to do auto brake and auto steer. So I became very much familiar with artificial intelligence developments. Well, when we sold the business, I had a 2-year non-compete, which meant I had to do something completely different. And healthcare seemed broken. So I thought, okay, well, I will come in and see what I can do with healthcare, right? The famous last words of every health tech startup CEO. And my first foray was actually just going to buy medical practices. And I thought, okay, well, I'll just acquire some. So I got with a banker, started doing due diligence for primary care, urgent care, surgery centers, even started looking at cardiology groups or things like that. To my astonishment, none of the medical practices were very good businesses in and of themselves. So because they weren't good businesses, as a financial investor, it didn't make sense for me to buy a practice to run it as a business, right? So I kind of took a step back. But when I did that, one of the people that I became friends with through this due diligence process asked me to help fix his business so it was a good business. And that's when I went in, and coming from outside of healthcare, you know, I looked at medicine with probably a little bit of a different lens than most physicians would look at medicine. I looked at it as you are making a widget. If you know, people have been to business school, they love that term. And the widget that you're making is a medical patient visit where the doctor is diagnosing and treating some type of ailment with some type of treatment plan, whether it's diet, exercise, you know, actual pharmaceuticals, surgeries, whatever it may be. And so when I started costing out that widget, because insurance companies, they've already defined how much they're going to pay. So we just have to figure out what the cost structure is. And I got in with a stopwatch, and besides annoying, you know, all of the doctors and nurses and front desk staff, you know, to no end, being timed on every single action, what I was able to determine was that physicians were spending nearly 70% of their time doing clerical work that has nothing to do with their licensure. And that was awe-inspiring, which basically allowed me to come in and create AdviNow. Because if you talk to any physician, you ask them, what do you hate about your job? They're going to say the EMR, or the electronic medical record, or the EHR, electronic healthcare record. Entering data. They all say they hate that. Well, if you could go to the doctor and say the AI does it all for you. Not only does the AI do the actual documentation where you record what the physician says and put it in the EMR, but the AI actually asks all the questions ahead of time, creates the workflows, determine whether the insurance company is going to pay for something or not. All of these little activities that the doctor, the nurse, the front desk, the back office all do to make a medical practice work, the AI does it for them.
Wow. Wow. That sounds impressive. So do you have a mental health arm in that, in the sense of, will it do a mental health EMR?
It will. So mental health obviously has been a very, very big area of medicine, specifically over the last 5 years or so, since social media has, come about. Mental health has become a very big part of anybody who's raising children, but also, our whole workforce in general since
Right.
COVID.
Right. Mhm.
So most medical plans require that you do some type of mental health screening as you are seeing the doctor. So we've all seen the questions or get asked the questions, do you feel depressed lately more than before? Or do you ever feel like hurting yourself? Or, these type of simple screening questions, if the patient answers the wrong way, of course, they lead into much more comprehensive questions. Do you feel that you have enough food to eat? Do are you worried about having a place to sleep or to lay your head? The beautiful thing about AI is we can take all of that and come up with the next questions and prepare a summary for the doctor so they can really get to the point of the patient's pain to help them in a most efficient way.
Wow. Wow. That's fantastic. Do you have mental health providers who use your programs?
Specifically, mental health providers, today we don't. Not that our system couldn't be used for mental health, but today at primary care, urgent care, you go into cardiology groups, nephrology groups, pain centers, spine surgery centers. These are examples of my clients today, people like the Mayo Clinic. Now, we are looking forward to mental health clinics also adopting us and using us in a more broader way.
Yeah. Okay. Well, we'll explore that. That sounds like another conversation. I would love to be a part of that. We'll talk about it later. So yeah, great. So tell me, what are your biggest wins or successes that you've had in your career so far? And how do you think you got there?
So, it's how you define wins is very interesting. I've had a number of exits that that have made me, a pretty good sums of money. And when you look at that, obviously that's a win. I'll use Silicon Labs as an example. When I was 29 years old, I joined a startup company in the semiconductor space, and we made technology for cell phones, TVs, communication devices. And we went from zero to $500 million in the space of 3 years. It was a phenomenal opportunity. The stock appreciated. Obviously, that stock appreciating made me a lot of money. And I look at that and I say, well, that's a win. But what was more amazing was actually just being part of the technological revolution that the cell phone industry and the communications industry has made on this world. In 1998 or 1995, I'll start there, I moved overseas to work in Japan. And believe it or not, email existed, but people still used fax machines. So we were faxing back and forth, and it's just amazing. You'd call the United States, it would be $1 a minute, and Skype or any type of IP calling didn't exist back then. So living overseas really meant you lived somewhere else and you lived your life a completely different way in a different culture. And now that's not the case, right? Now, just like us, we're talking over Zoom here. You're recording this. It's going to go on the internet. And this was unheard of 30 years ago. So I've been able to be a part of almost every technological revolution that we've had since the early 90s. And just being able to be part of that is what I consider to be my biggest win.
Yeah, that's great. That's great. So let's move over to challenges, because a lot of us have challenges as we're trying to live out our vision and live out our mission. So share a challenge that you've had and how you saw yourself coming out of it, how it built strength, resilience, something along those lines.
Yeah, so since I talked about Silicon Labs, I'll just stay with that for easy context. Um, Everyone has a dream of, starting a company. I guess not everyone. Most entrepreneurial people have a dream of starting a company, having it be wildly successful, and they don't understand what happens in between. And when I joined Silicon Laboratories, I was their first international employee. I was living in Japan, and this was 2001. So the company was losing money, and they couldn't really afford to pay big cash salaries to people. I mean, they were losing money. And who knew when the dot-com bubble burst, who knew when it was going to come back, what to do. And so I looked at that and I'm like, okay, I had an opportunity to join, but they were only going to give me a very low salary. And I had to go to my wife and convince her that, hey, this is going to be successful. And so got a good bunch of stock, but then joined the company with a low salary. I had to make it work. And so the challenges were taking a international operations, which was my initial foray, and figuring out what to do. Creating an entity in every country without having a lawyer sitting by your side helping you how to do it. Standing in line in the Japanese or Chinese city offices, Taiwanese city offices to be able to create the entity, hiring the team. Well, that's really not a 9-to-5 job, right? 24 hours a day, 7 days a week. And quite frankly, you don't know if the company's going to be there a month or two down the road. And so it's completely up to you to make it successful and to drive as hard as you can. And that is a mindset change. As an engineer, which was what I was previous to joining Silicon Laboratories, the only real decisions I had to make were architectural decisions about what I was designing, right? I mean, yeah, it's a hard decision. You get it wrong, you screw up, but yeah, if you screw up, the company will still survive, right?
Right.
When you're making decisions on price negotiations with Samsung Mobile, right? Or you're deciding who to hire to run a specific country and region, making sure you don't have graft, making sure you put controls in place, and you're making a million of those decisions every day. It is a different thought. You are the company. Your decisions will make or break a $50 million company. And it will impact literally hundreds of people's lives. So that hardship, if you will, or that change in mindset really changed the whole rest of my career. And I was able to bring that into my further positions where I had the opportunity to come into business units that maybe were performing less, where I came in with the confidence to make decisions. And every company I had hardships. Every company, if you're coming into an established company, and I'll use Freescale Semiconductor as an example, that they've been around for 30 years, right? They were Motorola Semiconductor before that. And Motorola is a nice storied company. They were the largest company in technology for a while, right? If you go back to the 80s. So my job was to right the ship, allow them to be profitable, change a strategy to deliver product. And by the way, it has to be done yesterday, right? And so making those decisions, living with the consequences, doing fast, being able to pivot fast if you end up getting it wrong, because sometimes you do, it is really a hardship, but also a thriving. Whenever I read Elon Musk's book, and and if you haven't read it, I would highly recommend you read it. It's educational. You know, Elon lives in this constant state of crisis, and people say he thrives on it. And, you know, in his book, he talks about it, you know, at least he talked about it to his biographer, you know, the person who wrote the book.
Mhm.
And it's not that you're thriving on the crisis. It's that you've learned to be able to survive the crisis. And so when I think about hardship, it's really learning how to survive the crisis. In healthcare right now, AdviNow Medical, what I'm doing, healthcare is really an anti-change industry. Very different than anything else I've done in my life, because people aren't compensated to make the healthcare industry better. They're
Right.
compensated to keep it the same. And that was weird for me. So how do you change an industry that is incentivized to not change?
Mhm.
It's that's the crisis that we're always resolving and coming up with new solutions and trying. So, you know, I'm not sure if that's the question, you know, what you were thinking about when you asked the question, but when I hear, you know, what is your most challenging, it's really learning how to be in crisis mode without being in crisis.
Yeah, yeah. So that kind of blends into some of my work as I help people with reducing stress and reducing the impact that stress has on their body, you know. And so I do a lot of work around that, primarily with trauma, but with other areas as well, because we all live in a high stress world. So we have stress
Sure.
just with our jobs, even decision fatigue. I was sitting there thinking about you making all these decisions as you're doing all these startup satellite programs, and I'm like, oh my gosh, I just couldn't make that many decisions without being exhausted, you know. So
Massively exhausted in the early days. Just you're
yeah,
not used to it, right? I mean,
yeah,
the stress of making a decision and then living with that decision and
mhm,
then doing that over and over and over again, it's a little bit of a different animal. And
yeah.
I had to learn how to do it.
Yeah, and I think this is something that a lot of people who are getting into business, especially for themselves, don't take into account and don't allow for. Like, you are going to have to push, 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 pressure, 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 do a lot of hard work up front. You know,
Yeah.
sometimes it feels like what's the saying? 10,000 hours makes you an expert. You know, giving 10,000 hours of shooting a basket or 10,000 hours of playing the violin or something like that. But I think what we don't take into account is sometimes that 10,000 hours is all in 1 year. You know, it just feels like it when it comes to decision making at the beginning
Yeah.
of a startup of a business. Yeah. So it can be really tough. But yeah. But you seem to have gotten to a place in your career right now where things kind of flow. I mean, there's a lot going on. A lot of, even just before we got on the call, you were making decisions and putting out fires and handling things. So how do you take care of yourself? I know it's not normally what I ask people, but I'm just curious, how do you take care of yourself each day?
Well, and that was also a somewhat learned experience for me. You know, when you're in your 20s, you can not really take care of yourself, and it's okay. You know, I say it's
Right, right.
okay, but you know, your body is rather robust.
Mhm.
As you get older, that's not the case anymore. And
Right.
so I really had to purposefully set aside for exercise, as an example. Um,
Mhm.
and if I don't get out and go hiking, or I do CrossFit and, you know, things like that in the morning to really wear myself out, then I just don't feel as good as I should. And my ability to handle stress is less. And
Mhm.
if I'm not disciplined in when I go to bed and when I wake up and what I put into my body, then then my ability to handle the world and the chaos that I live, it's noticeably different. And
Right.
so learning that discipline and really being willing to discipline yourself, which, you know, is not easy. It's a change in mindset where, you know, I really kind of want to watch this TV program, but I'm going to turn it off and I'm going to go to bed, because I know that if I don't, I'll pay for it, you know,
Mhm.
or, alarm goes off at 5 a.m. and you got to be at the gym at 5:30. I really don't want to be there. I'm worn out. I was on a conference call until 1 a.m. Well, as soon as you make an excuse to not go one day, then you never go, right? And it's just creating that discipline. It's super hard, and a lot of people are unwilling to do it, actually. But that's what makes a difference for me at least, being able to handle my stress load or not being able to handle my stress load.
Right. So you bring up a lot of good points. Movement is super important in helping you handle stress. Having a designated time to take care of yourself, also very important. And one of my favorite sayings, and I can't remember which book I got it from, but a disciplined life is a successful life, or a successful life is a disciplined life. We always think success is just living laid back, spontaneous, doing what you want. But most people who are successful are very disciplined in not just their work, but how they show up, how they take care of themselves to be able to show up and do the work that they're called to do. So I think you bring out a really good point about that, is that discipline that's necessary. So anyway, well, this kind of wraps us up for today. Thank you so much for sharing all of this wisdom with us. It was so good to talk to you. And for all of you listening, this is Tapping In. I'm Gwen Brain. We've been talking with James Bates from AdviNow Medical, and I look forward to talking to you again soon.